anatomy and the operative surgery. Clinical anatomy, what studies clinical anatomy? Clinical anatomy studies and describes the organs and tissues disposition according to the body place. You have studied anatomy, you know what studies anatomy. It studies human body by systems, but clinical anatomy studies the human body into the regions. Study the human body into the regions includes study the region into the layers. By which layer is covered the region? Which structures are located into these layers? Syntopy, relationships of the tissues and organs to each other, and operative surgery studies the surgical operations on that area. Operative surgery is teaching about surgical operations, rules and techniques. So we start our studying by common principles of an operative surgery. Common principles of an operative surgery, which includes what means surgical operation, what means operative surgery, how is performed surgical operation, which stages include surgical operation, what types of surgical operation we have, classification of the surgical operation, which instruments are used during the surgery, how the tissues are dissected and how is stopped bleeding from the vessels, which methods we have to stop the bleeding from the vessels. So our topic includes this today. So as we have told, so when we finish the common principles of an operative surgery, after that we start studying the clinical anatomy of the regions, and after this we explain clinical anatomy of the head region. So our today's topic is common principles of an operative surgery. As we have told, operative surgery studies the technique and rules of the surgical operation. Surgical operation is fulfilling mechanical influence on the organism for the purpose of diagnosis and treatment by a doctor. Main purpose of the surgical operation is remove pathological changed tissues, which is the main condition to restore the integrity of the tissues. To perform surgical operation, it includes three stages. Which includes operative access. First stage, so will be operative access. Second step is action, operative action, and last of the surgical operation is recovery from the operation. Operative access, what means operative access? Operative access ensures finding out an operating organ. So to make incision, making incision for accessing that structure which must be operated on. And from different types of incision should be selected the most rational incision during the surgery, because rational incision gives chance to operate on the organ widely and more successfully. For these different types of accesses, we have direct access and we have indirect access. Direct access means what? Direct access means when incision is performed on the projection line of the organ, which we study during explaining of the clinical anatomy of the region. So direct access means when incision is performed on the projection line of the organ on the skin, and indirect access means when incision is performed on the side. So it is also called roundabout access. So From these different types of incision should be selected most rational incision during the surgery. Are cases that direct access is most reliable, cases that indirect access is reliable. So during the surgery should be selected most rational incision to operate on the organ successfully. Second step of the surgical operation is an operative action, what we have told. Action is technique of the surgical operations. In the case of one and the same disease, several operative action can be perceived. And the last step of the surgical operation is recovery from the operation. Recovery means when finishes surgical manipulation, all the tissues must be restored, which were violated during the surgical operation. So all the tissues must be sutured. This is recovery from the operation. Surgical operation, we have different types. We have bloody operation, we have bloodless operation. Operation may be radical, may be palliative. Operation may be one momental, two momental, multi-momental, maybe diagnostic, maybe the medical urgent, planned. So different types of surgical operation we have. Bloody means when is performed the dissection of the tissues, in which is starts bleeding from the tissue, so that's why it is called bloody operation. Are types of the surgical operation where is not performed dissection of the tissues, but it is also surgical operation. For example, removal of the foreign bodies from the organ. Yeah, this is bloodless operation. Radical operation means when there is completely removed all the pathological changed tissues. Radical operation means when completely is removed all the pathological changed tissues. Palliative operation means which is performed for the purpose of the facilitating the patient's stay. So are some conditions when can't be removed that pathological processes during the surgery. So are cases that there is non-operable tumor, for example, in the organ, but in this case is done the surgical intervention for the purpose of the facilitating the patient stay. So such operation is called the palliative operation. We have told also that operation may be one momental, which is performed in one stage, two momental, which is performed in two stages, multi-momental, which needs many stages for performing. And such a surgery is mainly used during plastic and rehabilitative surgery. Medical and diagnostic also may be the operation, medical for the purpose of treatment, diagnostic for the purpose of making diagnosis. Operation. Different terms are used during the surgery, which we must know, such as tomia, stomia, ectomia, amputation, and resection. For example, tomia means to incise, stomia means to make hole on the organ, ectomia means when there is completely removed the organ, resection means when it's partly dissected the organ, and amputation means when is partly removed the organ. So these terms are merged to the organ name and we get name of the surgical operation. For example, tracheostomia means what? To make hole, fistula on the trachea. There was performed the resection of the stomach, so partly has dissected, the part of the organ was removed during the surgery. During the surgical operation is used instruments. Instruments, and mainly these instruments are divided into two types of instruments we have. Do we see the picture on the screen?
Yes, Professor.
Students. So mainly is used two types of instruments. We have main surgical instrument and we have instrument of special function. So what is differences between these instruments? Main instruments are that instruments which are used in all surgery, and instrument of special function is that instrument which is used during specific surgical manipulation. For example, instrument of special function is this instrument. Do you see what I show you now?
Yes.
Do you see? So tracheostomial tube. Tracheostomial tube is instrument of special function. Why it is instrument of special function? Because it is used only during tracheostomy operation. In other operation, it can't be used. So this is instrument of special function. Main surgical instrument, as we have told, yeah, is used in every surgery. So on the screen, we see now main surgical instruments, which is divided into 4 groups. First group, function of the first group is which is used for dissection of the tissues. Second group, function is to stop bleeding from the vessels. Third group is called assisting instruments or fixation instruments. And fourth group are instruments which are used for suturing the tissues. Let's explain each group instrument. So which instruments we have in each group. First group, we have told that are instruments which are used for dissection of the tissue. So for dissection of the tissues are used different types of scalpels, knives, and different types of scissors. These are scalpels, what you see on the picture. We have bellied scalpel, sharp-tipped scalpel. This is amputation knife, which has more big blade. Handling of the instrument, scalpel. In the hand, we have different position, how to handle this instrument in the hand. We have 4 positions we see on the picture. We have table knife position, we have pen position, we have bow position, and we have sword position. Different position for different cuttings. For example, table knife position is used for dissection more rough tissues, elastic tissues, and that's why index finger is placed on the blade, because trunk development needs such tissue during cutting. Pen position is used for more delicate cutting. Bow position is used for superficial cut, and sword position is used in amputation operation. So during amputation, which means removal of the peripheral part of the organ, instrument, amputation knife, must be handled in the sword position. Instrument also which is used for dissection of the tissues, we have scissors. Scissors are different types of scissors we have. Scissor may be straight, may be sharp tip. Scissor may be straight, may be blunt tip. Scissor may be curved on the direct line and blunt tip. This scissor is called Cooper scissor. Scissor may be bent on this side. This scissor is called Richter scissor. So handling different types of scissors for dissection of the tissues. This is Cooper scissor, what we see on the picture, and also I show you here Cooper scissor. Handling of the scissor, we have this position. Thumb finger must be placed in one ring, forefinger another ring, third finger on the ring, and index finger on the lock. And like this, tissues are dissected. So every instrument has its rule how to handle in the hand, because instrument must be located reliably in the hand during making surgical operation. Second group of the instrument, we have clamps. Clamps are the instruments which are used for stopping bleeding from the vessels. Clamps are used for this. Clamps has a lock. Differences from the scissors is what this instrument is closed and is opened, and the branches of the instrument is serrated. I show you now. This is clamp. You close and open instrument. Different types of clamps we have. Clamp may have tips at the end. Such clamp is called Coher's clamp. So we have straight and bent Coher's clamp. We have clamp without tips. Such clamp is called Billrods and Pear's clamp. We have straight and bent. And we have clamp which has short working end at the end. This is called mosquito's clamp. This is Coher's clamp. Handling of the clamp is in the same position as the scissors. So thumb finger is placed one ring, fourth another ring, third finger on the ring, and index finger on the lock is closed and is opened the instrument. So if we can't open, I will push this thumb finger on the ring and it's easily opens. Instrument must be closed at the last tip, not to open during the manipulation. So these are instruments which is used for stopping bleeding from the vessel. But except the instrument to stop the bleeding from the vessel, we have different methods how to stop the bleeding. It depends from which caliber of vessel we have bleeding. We know that vessel may be different calibers. We have small vessels, we have big caliber of vessels. And for example, for small arteries, stopping bleeding may be used electric knife. So electric knife, which is used for dissection of the tissues, also it's used for clotting blood flow from the vessels, is applied on the small vessels, and by electrocoagulation is stopped the bleeding. This method we can't use on the magistral vessel, on the big caliber of vessel. For example, on the brachial artery, it is big caliber of artery, and for stop if we have bleeding from big caliber of vessel, one of the methods to stop bleeding from magistral artery is ligation method. What means ligation? Ligation means to put knot on the vessel. I will show you later the video of this procedure. So first, what must be done when we have bleeding from the artery must be applied what? Clamp, yeah, to stop bleeding from the vessel. Then is dried the wound from the blood flow is decided which method is used for stopping blood flow. Ligation means to put knot on the vessel. So one of the methods to stop bleeding from the magistral artery is ligature. Apply ligature. So during applying the ligature, at first we must apply the clamp on the vessel. After that is applied the knot on the vessel. Two knots are applied mainly. First knot is applied after clamping of the vessel. Second knot is applied when is removed the clamp. So two knots on the magistral artery during ligation. First knot after clamping of the artery. Second knot is applied when is removed the clamp. Surgeon checks that there is no bleeding from the vessel and is applied second knot. But ideal manner to stop the bleeding from the arteries is to suture the vessel. So when is taken central and peripheral part of the artery and is sutured to each other. But why this ideal manner? Because it restores normal circulation of the blood flow in the lumen of the vessel. It's ideal manner, but in every case it can't be used. So it depends what type of trauma we have in the vessel. So if we can't use this method, suturing of the vessel, is chosen other methods such as ligation method. Further group, what we have told on the main surgical instruments, we have assisting instruments. So these are assisting instruments, what we see on the picture, which includes different types of forceps, different types of retractors, probes, and assisting clamps. Forceps, we have three types of forceps. We have surgical forceps, anatomical forceps, and pole-like forceps, which is called the gripping forceps. Function of this instrument is to hold the tissues. Hold the tissues, it is holding in the pen position from the middle part of the instrument. Pen position from the middle part of the instrument. Different types of forceps for different tissues. Surgical forceps is used, which has tips at the end for more rough tissues. Elastic tissues, anatomical for tender structures, pole-like, which is also called gripping forceps for small organs. This is pole-like forceps, which has pole-like ends for holding small organs. Retractors and hooks, what we see, are instruments which are used for widening the wound. When doing surgery, when tissues are dissected, the wound must be widened to access the organ, which must be operated on for clear view during the surgery. So we use paper-like retractor, which is called Parabex retractor. It is placed on the palmar surface of the hand, then in the tissues, and the wound is widened. Hooks have tips, as you see, it may have from 1 tip up to 14. So function is for retracted, for widening the wound. Probes, we have patent probe and we have grooved probe. Grooved probe is this instrument, what we see. Grooved probe has groove in the middle part of the instrument, and this instrument helps for dissection of the tissues in some layers. For example, during dissection of the fascia, except using the scalpel, is used this grooved probe for separating the fascia, which covers the muscle closely. Under this fascia is located vessels and nerves. So to avoid damage by scalpel dissection of the fascia, vessels and nerves, by grooved probe is separated fascia from underlying muscles, and on this grooved probe is dissected the fascia, which is placed under the fascia layer, and by this avoids damage the vessels and the nerves, which is located underneath. This is patent probe, which is used for revealing the foreign bodies in the organs. Also, we have in assisting group linen holder and Corsacchi. Linen holder is used for holding the operational linen during the surgery. So during the surgery, operational area is covered by the linen. Why? Because to separate it from healthy tissues and to not to move this linen during the surgery, it is held by this holder. This is Corsacchi, which has long branches. This is used for cleaning the operational area. Cleaning the operational area, so skin of the area must be cleaned well by antiseptic solution before there starts dissection of the tissues. So by this instrument is taken the cotton, which is placed in iodine or in betadine in antiseptic solution, and very well must be cleaned the skin of the area which must be dissected. Why? Because not to get infection from outside inside the tissues. So I repeat, assisting instrument includes which instruments? Forceps, retractors, hooks, probes, and assisting clamps. Fourth group of the main surgical instruments are used for suturing the tissues. For suturing of the tissues, we need needles, needle holders, and threads. Needles, we have different types. As you see on the picture, needle may be curved, needle are different sizes, needle may be straight, needle may be handled. This is handled needle, Deschamps needle. These are needle holders by which is holded the needle. Needle may be curved, may be half curved. It depends which layer is sutured the tissue. So different needles is used for different tissues. If we suture deeply in the wound, is used more curved needle. If we suture superficially, is used half curved needle. Needle has two ends, tip of the needle, and the other side we have a hole where is placed the thread. Tip of the needle may be sharp tipped or maybe round tipped. Round tipped needle is atraumatic needle. Atraumatic, which is used for tender structures, not to get the trauma to the structure. So for such tissues such as vessels, nerves, tender structures sutured by a traumatic needle, but are tissues which are sutured by sharp-tipped pricking needle. Needle holders may have rings at the end, may have curved branches. This needle holder is called Hagar's needle holder. These are ITS needle holder. There is a rule how to place the needle in the needle holder. You see that you must hold the needle so that tip of the needle must face you. It is placed in the middle part of the needle holder in the border of upper and lower part, so it's the level of middle part of the branches of the needle holder, so that 2/3 part of the needle is located to the tip and 1/3 part is located to the hole, and then is holding the thread with the instrument, which are from outside. Inside is placed in the hole of the needle. And before start suturing, on one side must be located 1/3 part of the thread, other side is located 2/3 part of the thread. So this you will make at classes. Threads which are used during the suturing, thread also we have different types. Thread may be synthetical, may be natural. Thread may be absorbable and may be non-absorbable. Thread may be monofilament and may be multifilament. It depends which tissue is sutured. So monofilament threads are used for tender structures, multifilament more for thick tissues during the suturing. So, do we understand?
Yes.
Yes.
Have we any question in this part? Okay, so we have told that one of the methods of stopping bleeding from the vessels is ligation method. Yeah, ligation method. So hemostasis by making ligation. So now I will show you the video, what we have told. Let's see on the video. Do we see now video what I have shared?
Yes.
Okay. So hemostasis, what we have told.
Demonstrate two methods of hemostasis. Firstly, a single vessel in a small bowel mesentery. We start out by picking up the peritoneum just over the vessel and very gently dividing that leaf of peritoneum, being careful not to go right the way through. At all times, we must avoid damaging the vessel. Very gently start to isolate the vessel, and then it can be picked up gently, and the scissors can be used to tease their way underneath the vessel. The instruments here look massive, but this is because it's such a small vessel that we're isolating. One can see here the vessel and the small strand of peritoneum that can be picked up and gently divided, leaving us with the vessel in isolation. A hemostat or other suitable clip can then be passed under the vessel and a fine tie inserted into it and drawn through. Be careful not to cheese wire through the vessel or to pull on it too hard, as this vessel is very fine. Tie a carefully laid reef knot using the index finger to snug it down rather than to pull on the vessel. 3 throws are required once again, each laid properly.
So ligature method. 2 knots are applied.
Having tied the knot, place that in the hemostat and lay to one side. Once again, pass a hemostat or clip under the vessel.
So on the both sides must be applied the ligature during making ligation, central part and peripheral part.
Then tie a reef knot so that the vessel has been tied twice in continuity. Once a second reef knot has been satisfactorily tied and the ends of the
Between
suture
these
material
knots,
placed in the
it
hemostat,
must be
then the vessel
dissected.
can be divided between the 2 knots.
Other technique of
Suture
applying
material
the
cut,
ligature on
and
the
then we
vessel
have a ligated and divided vessel.
will be shown now.
The other method of hemostasis to be demonstrated is more suitable for pedicle ligation. Here we see a leash of vessels, again in the small bowel mesentery. We are going to divide this leash using a different technique. In this situation, the peritoneum is divided through both leaves of the small bowel mesentery on the side of the leash of vessels. The entire pedicle is then picked up and placed in the hemostat, which is laid down gently, and a second hemostat is placed as demonstrated here. The pedicle can then be divided with scissors and a suture placed round each of the hemostats and tied, again using a reef knot. When the first tie is snugged down, instructions are given to the assistant to release the hemostat.
So at first is applied clamp, is done first knot. We remove the clamp, is applied the second knot. So during making ligation, we must know to perform the knots, yeah? Knots which we have different types. We have what simple knot and we have double surgical knot, which functionally are differences from each other. Simple is less stronger, double surgical is more stronger. These knots we make at classes. Technique, how is this knots?
And once again, instructions given to the assistant to release the hemostat once the first throw is satisfactorily tightened down. 2 more throws can be placed, laid properly, and then the suture material cut. This technique is suitable for pedicles and the
So what is called this we have seen now? Ligation. Yeah? Okay. Suturing, dissection of tissues and suturing of the vessels, we continue next lecture, student. We don't have time now. So, have we any question? Student, textbook, which we... Yes, I listen to you.
Ma'am, your voice is cracking, so could you repeat what you said?
You can't hear me?
Now I can hear you, but before I didn't hear what you said.
Student, textbook which we need is this textbook. Look, clinical anatomy and operative surgery. This textbook we need both semester, this semester and next semester. So everybody who does not have this textbook, you can get this textbook in the first building. There is bookshop. Do we understand?
Yes.
Yes.
Yes. Have we any question? Today
No.
we finish. What? Pages?
No, nothing. I said it's clear.
Clear. Okay. If we have not questions, today we finish, student, and next week we continue.
Doctor,
this course. Yeah?
about the pages, which pages
Pages
we should see?
from the textbook will be from 7 page, included 19 page, student.
Okay.
From this textbook, from 7 to 19 page.
Mhm.
I have sent in the chat.
Okay, thank you, doctor.
Okay, thank you. Goodbye.
Bye.
Thank you, Professor.
Bye, goodbye.